properly. Dry with a clean towel. If there is no water, do the same washing motions with an alcohol-based hand sanitizer containing at least 70% alcohol.
Wash your hands. Wash them right. This message brought to you courtesy the Bureau of Health Education of the Ministry of Health and Wellness.
Thank you so much for being patient, St. Lucia. Those in the diaspora, the wider world, we did promise a 12 noon start, but as with anything else, we do know that the individuals who are at the head table are very much on the ground, and it is not always easy to escape the sort of footwork and soldering that they're doing on the ground, and we apologize for the late start. However, it is still going to be an informative session for you. At the table, we have the Chief Medical Officer. She's Dr. Sharon Belmar-George, Dr. Wayne Felicien, who is the Director of the Ezra Long Laboratory Services, and Parker Ragnanan, who is the Chief Environmental Officer. We want to say thank you so much for making it in. As I indicated, we do know that it is a very, very trying time. Dr. Belmar-George, perhaps do you have an opening statement? Or?
Yes, good afternoon, everybody. As per usual, I will start off with just a review of the international and regional results that we've noted with COVID-19 to date. WHO reports a total of 292,142 confirmed cases to date, with 12,784 deaths. For the region of the Americas, it's a total of 19,685 confirmed cases, with 252 deaths. To give an idea of our islands, Cuba, a total of 16, Jamaica, 16 cases as well, Guatemala, 12, Trinidad and Tobago, 9, Barbados, 5, Guyana, 5, Bahamas, 4, Haiti, 2, Antigua and Barbuda, 1, St. Vincent and the Grenadines, 1, Guadeloupe, 51, Martinique, 32, Puerto Rico, 21, Montserrat, 1 case, St. Martin, 1, St. Bartholomew, 3, Cayman Islands, 3, St. Martin, 4 cases, Aruba, 5, U.S. Virgin Islands, 6. For St. Lucia, we currently have a total of 3 cases. We have our third case is a 43-year-old female with a travel history to the U.S. She came back, experienced flu-like symptoms, and was tested and treated, and she's presently in isolation. Our teams are working closely with her possible contacts on the ground presently. She's doing well, she's recovered well.
That's it?
Yes.
Okay, so we just want to start right there with your last piece of information there. The individual from the U.S., do we have a time frame as to when she entered the island?
From the information I have here, she came into our system on the 12th of March, and with flu-like symptoms. She was seen and reviewed, and we got the test results yesterday.
Okay, and she had been staying with family, friends, or was she at a hotel? Because she came in on the 12th of March.
She was isolated alone.
Okay, so she was isolated upon arrival?
Yes, she was isolated alone upon arrival.
Okay. So are you saying then that her contacts with other individuals, we will believe that to be minimum?
Yeah, from the information we got, we will provide further information later on as our teams are on the ground. But she was isolated, not within our hotel, because as you are aware, our hotel only opened up on Friday. But she was under home isolation because she lives alone. So, and she has been alone since. So we are working, our teams are working. When we get further information, we'll provide it to the public. I would like to take the opportunity to give some information on our plan for in-country transmission as to what is available and how it can be used for the public to access services. Our 311 line providing information to the public, as we had indicated earlier, that it would have been ready for the 23rd of March. I would like to announce and advise that it is ready and available. The hours are 7 to 7 p.m. from today. It is fully functional. We are working with another agency to extend this to make it 24 hours so that it will be a full hotline apart from those hours.
And just to reiterate, that hotline, once an individual were to call, they would be receiving what sort of information there?
It will be general information on COVID-19. We will be distributing through the support of Digicel. We've received 40 cell phones, which will also form part of our response. We are hoping to distribute these phones this afternoon to our clinical partners. Based on our collaboration with the ministry and the private physicians, this service will be available. At present, we do not have, I want to indicate clearly, at present we do not have evidence of in-country transmission of COVID-19. But in anticipation and with our planning, these clinical lines will be available to the general public that they can call at any time to get information on their health status. For example, if you live in a community, you develop respiratory symptoms, you could connect directly with a physician, and this phone will have the capacity of video. You'll be able to explain your signs and symptoms, and you'll get direct information at that time. In the phase of in-country transmission, we would, as much as possible, try to limit the movement of persons and try to limit persons going onto a bus or going to facilities, especially since, as we indicated earlier, most persons would get mild disease. So in those cases, you can call the physician and get clinical advice as to what should you do, because not every person would need to go into a healthcare provider. So your first point of contact would be calling one of those phones to get advice. I want to also indicate these will be shared with the public by tomorrow, so you'll know we'll have support for both psychosocial support and clinical medical support as well. And we will also share direct cell lines to our 5 respiratory clinics. So you can call a respiratory clinic, you can get psychosocial support, or you can get clinical medical advice as is needed. The physicians answering will then indicate to you if it's a mild disease and advise you what to do. If it is somebody with risk factors, for example, or there is some indication of the severity of your condition, you then be advised to go to your nearest respiratory clinic, where you'll be seen by one of the physicians. Our respiratory clinics, all 5 of them are currently open. The locations are the Grosley Polyclinic, the Leclerc Wellness Center, the Soufre Hospital, the Dennery Hospital, and the Viewfort Wellness Clinic. So you'll be advised as to if you need to be reviewed by a physician there, that you can go in to get checked, or you could also be advised to go directly to the hospital, which is the respiratory hospital. The Victoria Hospital will be moving over to the OKEU next week from the 25th to the 27th, and after that move, it will be available as our respiratory hospital, where we will house more severe cases. Persons who need admission would be accommodated there.
So that means this week. I know,
Well,
I know
yes.
you've been a bit of a time warp. Yes.
I beg your pardon?
It's the 25th to the 27th of March?
Yes, that's
Okay,
Wednesday
so-
to Friday.
Okay, so we're looking
It's
at
when-
this week.
We're looking at
Yes.
this week. Yes, for the move to facilitate that any need that we have for admissions at that point.
I know that, just pardon me, Dr. Belmar, I know that Dr. Felicien has to go because, again, he is a soldier there on the ground. But lots of questions coming in pertaining to testing before you continue on with your notes. At the Ezra Long lab, testing, we know that training, the staff had undergone training. Are we now at the stage where we are able to get testing underway in St. Lucia from today or this week?
Yes, we are on schedule to start testing. Hopefully within the next 24 hours we should be able to roll out some form of results. We have limitations due to traveling issues, shipments arriving on time, but we forecast being able to test at a capacity of probably 40 to 80 persons per day. And if you look at the weekly totals, you're looking at probably between 200 to 400 persons per week with the existing system. We're looking to do an upgrade as soon as possible, and that might bring it up even higher.
Okay, when you say that there may be delays in some shipment, perhaps if you can just explain what that means.
When we focus on delays, we're reliant on increased requisitions for the reagents, the controls from our suppliers. So we're just looking for that to come on as estimated. Okay.
Now, Doc, as we begin to test, and we're looking at, as Dr. Felicien indicated, 40 to 80 tests per day, are we now likely to see in-country transmission as a result of that?
Dr. Felicien has been working quite diligently on our change of protocols in relation to our in-country capacity to test. So I think I will let him explain some of the recommendations for in-country testing.
Okay. Right now we're primarily reliant on persons coming to us, and due to the limited testing capacity. As our capacity increases, we need to now answer some pertinent questions. And some of these questions are, do we have in-country transmission? And obviously to answer that, we need to open our umbrella to testing and start testing more extensively, especially the at-risk group, the travelers, the healthcare workers, and persons that might be vulnerable to it. So we're trying to develop some algorithms. Hopefully they can be approved by the Ministry of Health, and then we can inform the public as to what the pathways are towards testing. And with all that information coming in, we as a group can then analyze and see how we can guide our decision making forward, whether restrictions need to be tightened or whether they need to be loosened. But it will guide us primarily in what strategies we need to implement.
Okay. So a question coming in here about how many test kits do we have at this time?
At the present, we're supposed to get about 900, so we're just waiting on that within the next 24 hours. On island, we have kits, but we're limited by having no controls, so we're just waiting on that.
Okay. And so the question now is, do people, I know you said that there will be more information coming forward, but the of immediate concern here is whether people now have to come to the lab, or do they need to go to the clinics as identified by Dr. Belmar-George to get those tests done? Can they do testing at these clinics or within communities?
I think with increased capacity, we now need to change our strategy and try to make testing easier, more accessible, and we need to try and make it more focused towards the populations that we need to strategize. So once we can come together, organize different task forces that can handle those volumes with minimal interruption on normal service, we should be the public should be receiving some information, and those groups that we're talking about, healthcare workers from the various hospitals, from the various hotelier industries, we can then be able to collect the samples with the requisite quality that is needed, minimizing the risk of infecting other persons, whether they are positive or negative.
Okay, just somebody seeking clarification, and it's so important to be clear with the information. What do you mean that you have the kits but no controls?
Once you do a test, you need to run the test kits, which will analyze the RNA, and then you need to have controls which ensure that your tests are being run according to the quality standards that it is.
Okay, very well. Thank you so much there. Dr. Belmar, anything else that you want to add to that?
Yes, working with our lab director, when we have full capacity, what we will be looking to do is some level of testing within the respiratory clinics. Because as you would imagine, in the early phases of the outbreak, in the earlier stages where we didn't have any on island at all, we were looking to see when there's a possible level of in-country transmission. So our present testing capacity is looking at travelers coming in who develop respiratory signs and symptoms, and those are the persons that we have been putting all of the effort to ensure that they get tested. We will be looking to see, testing different communities to see if there are persons with it, and also this will further change if there is a level of in-country transmission to more severe cases within the hospital or hospitalized cases. So the testing strategy will change, and we're working with and guided by our lab director. So today we are not telling persons that everybody who has a cough and cold go to get tested. That's not the correct thing. Our respiratory clinics are open, so if you have any concerns, you can go to any one of the 5. By this evening, when we distribute all of the phones and we share all of the numbers with you, it means a lot of persons could just stay home and call and get advice over the phone, and then you'll be directed as to whether you do need to go into one of the respiratory clinics or if you need to go into the hospital. I also think it's necessary for me to clear up a little bit of the change in strategy that we had since we opened up our public health facility on Friday. I beg your pardon?
At Rodney Bay?
Yes, at Rodney Bay. In the initial phase of our management, based on the travel restrictions that we had posted, we had 2 options available for quarantine. One was home quarantine. And let me just clear up the difference so that everybody has it clear. Quarantine is for persons with a travel history in the last 14 days to an area of interest. So if you went to an area of high risk for COVID-19 and you're coming back, and this is within the last 14 days, which is the incubation period, we would quarantine you. Now, these are people who are well or who may or may not have been exposed to a communicable disease. What we did, our team would review the homes of those persons coming in. If you did have the conditions to facilitate home quarantine, it was allowed, and we would review and do temperature checks, check your vital signs, so that we could pick up very early if you developed the disease, and then we would put you in isolation. Isolation was used for persons with the 14-day travel history out of a place of high disease index. If you develop signs and symptoms, isolation was within a facility at our public hospital. This is how we were moving up to last weekend, in anticipation of higher levels of persons coming in from high-risk areas. The human resource necessary to do the level of home quarantine that we were doing within the communities, and to give us enough time to review the homes as adequate. As much as we were working with a small guest house where we would put persons who did not have those capacities. It was more difficult and human resource exhaustive. So we had been working to get some hotels which would allow us more capacity within one area so that we could do the necessary reviews within a shorter period of time, and to ensure that the rules of quarantine were obeyed. We did have challenges with home quarantine, and we continue to have challenges. As we indicated before, we monitored twice a day. We would get reports, but to ensure that persons abided by the rules of quarantine, having them in one facility, we thought would have been a lot more secure, and then we can monitor easier during that period. So from Friday, we were able to open up the Rodney Bay Public Health Facility, where we have since received passengers from Martinique, from the UK, a wide range of areas so far we've been able to keep. We also have persons in isolation at that venue. Friday was a very tough start when we did receive our first group. It was very chaotic on Friday night. We did have issues with quarantine persons escaping during at some point, but with the support of the Royal St. Lucia Police Force and the communities, what we depend on greatly to share any information that they have on persons coming out of high-risk groups. We have been able to ensure that they will safely return to the quarantine site. As of Sunday, we continue to receive passengers from different flights, and it has been going a lot smoother, maintaining the rules and abiding by the laws of quarantine. We did have some errors, I must admit. During our first group, there was a group, about 7 Dominicans, who were not supposed to come together with the group because Dominica on Friday, there were no cases of COVID-19, so they were not seen as a risk.
But did they travel on the same express diesel vessel?
But they were separated in terms of the part of the boat. And this, I have to acknowledge Ms. Joanna Salton, who coordinated this from a week before to facilitate the repatriation of our nationals in Martinique, persons who wanted to come. And she did do her utmost to work with them, to inform them before, and to put everything in place to facilitate their return to St. Lucia. So this was one of the errors that was made, and we've reviewed to ensure that it does not happen again, that it's only those who need to come into quarantine would quarantine. We also note that with the numbers coming in, when we look at the numbers coming in, even today, we did have to make some considerations for home quarantine as well, because it's a lot of people coming in a short time. We are working with the Ministry of Tourism Authority and SLHTA to establish a second and a third quarantine isolation site. So by a little later today, we should be announcing a second site to be able to increase that capacity, because we've noted that from the 18th, the numbers coming out of the US, for example, from New York, they are also high risk, and there is a need for quarantine of persons coming in from the US.
Are we talking strictly returning nationals, or are there U.S. nationals and other nationalities included in that? So
well,
in other words, tourists.
Yes, with the travel restriction, and I have to indicate that during the last week, the borders have been open to facilitate returning nationals. Some flights, for example, BA and Virgin, have been coming in to take UK nationals back. So those flights have been coming in almost empty with a few nationals, and it's a lot of the UK nationals that want to return home have been going back. But we're working to extend the numbers, and we keep monitoring what is happening in the international arena. I don't want to preempt any pronouncements, but there will be pronouncements coming out later today to address the situation of the borders. So after this pronouncement, it will resolve a lot of the issues that we note with quarantine and isolation of persons coming in. But I have to extend to the teams, the health teams, and the management of a quarantine facility, and putting in a lot of the measures that have been, it has really been teamwork from all of the different organizations. I have to commend my team from the Ministry of Health. We have officers such as our medical officer of health and the director of bureau who stayed up the entire night to ensure that the first night everything was put in place and everything was safe and secure. And apart from having a safe location for quarantine and isolation, they also ensured that the necessary psychosocial support was given to persons who needed it at the time. Our pregnant women, small children, the elderly, special consideration had to be given to them. Persons with comorbid conditions, to ensure their medication was delivered. All of this was done within 24 hours, because by Sunday everybody was settled and everything was going well. So I have to commend all of the different agencies that worked tirelessly to facilitate this, and also our teams who worked around the clock to ensure that this was done in a safe manner. We note that, especially in the beginning, it won't be perfect, but we continue working to reduce this. A number of other measures were done to, let me just explain with the situation on the weekend, because I want to send out a special appeal to the public and the communities. We commend very much the communities who worked with the police on the weekend to ensure the return of those under quarantine. We were alerted on persons coming in illegally through various spots, and we want to appeal to the public. If you are aware of persons who should be doing home quarantine, and even from the US, for example, persons coming in from New York, they should also be under home quarantine. I did get a lot of calls on the weekend that there were persons who came in from the US and were not notified of the need for quarantine. So they should be doing home quarantine. We will be getting all of the lists from the airlines and ensure that this is obeyed, so that it would ensure the quick testing of anybody who develops respiratory signs and symptoms.
Why are they not being made to do the mandatory quarantine?
Because of space limitations at this point. But as we expand, we will be ensuring that anyone coming in under those will do the mandatory quarantine as well. So we will be getting those lists, and we will be appealing to the public. But especially in the case on the weekend where we know we were informed of persons coming in illegally through ports, we appeal to the public. This is the health of you and your family that is at risk. If you are aware of anyone who came in and should not be there on island, to just notify us, and the Royal St. Lucia Police Force will do the necessary to facilitate quarantine. We need the support of the community at large. We are working to reduce in-country transmission. We are trying to keep the public safe. We want to reduce the impact, but we need the support of all of our communities in that measure.
Okay, on that note, we will take a very short break to come back and to continue the conversation. Stay with us. We are focusing on the national response to COVID-19.
Wash them right.
With soap and lots of water. Get between fingers. Get under the nails. Go above the wrists. Do this for no less than 15 seconds. Rinse properly. Dry with a clean towel. If there is no water, do the same washing motions with an alcohol-based hand sanitizer containing at least 70% alcohol.
Wash your hands. Wash them right. This message brought to you courtesy the Bureau of Health Education of the Ministry of Health and Wellness.
What's in the food you're eating? Do you really even know? All the chemicals and hormones used to accelerate their growth. All the artificial flavoring, sweeteners and colors too. We consume and we don't spare a thought for the damage that they'll do. No, think about the children. Think about the children. How will we save them? Chemicals and GMOs are not the solution. Use organic and join.
Excessive agrochemical use, additives and genetically modified foods are harmful to health and the environment. Join the good food revolution. Grow, buy and consume organic. A message from Rise St. Lucia and the Ministry of Sustainable Development with funding from the GEF Small Grants Program, UNDP.
The good food revolution.
Response on COVID-19, and earlier on you would have heard the Chief Medical Officer announce that St. Lucia now has an additional case positive for COVID-19, and a female arriving in St. Lucia March 12, 2020 with flu-like symptoms, and that has now proven to be that of COVID-19 coming in there from the United States. Lots of individuals commenting on the borders, but we did indicate that there will be an announcement coming through, and so no need to preempt what that official announcement would be. But over to Mr. Parker Ragnanan for a moment. The discussion on thermal guns, are we now using that at our borders now that we seem, although we have restricted to some degree the sort of flight traffic, however, we still have large numbers coming in. So how are we managing at the port?
The protocols established for the ports are very clear at this time. One is all persons that are coming into St. Lucia are screened. Part of the screening would include the temperature checks, and the instrument that is used is a handheld thermometer to get the temperatures of persons who are coming into St. Lucia. Apart from the temperature checks, we also have our healthcare personnel at the ports of entry who are monitoring persons for signs and symptoms of a respiratory illness. Any persons with elevated temperatures or respiratory symptoms are placed in a holding facility at the port and referred to a healthcare institution for further evaluation. Persons who do not exhibit signs and symptoms and do not have an elevated temperature are allowed to go through the normal clearance process. And I want to say that with some caution. It is persons who are coming from countries that are not on the restricted list. So for all persons, including nationals, who are coming into St. Lucia from the restricted countries are to go into mandatory quarantine. And as our Chief Medical Officer has already explained the process for quarantine, there is the option of home quarantine or to be placed in a public health care facility for quarantine. We have seen the challenges in terms of that. And one is persons, even when you tell them in advance that it would be quarantine, have the notion that I can come to St. Lucia, it's my home, and I'll get to go free. And therefore, persons I've seen resist tremendously the efforts of being quarantined. And we need to understand the principles for quarantine. We say over and over again, quarantine is different to isolation. Quarantine is for people who are well, but we believe that you may have had contact with somebody who is sick. You're coming from a country where there is widespread transmission of the disease. Therefore, it is prudent for you to remain under monitoring to see if you yourself develop any symptoms, so that very early you would be able to be tested and treated. It means that you're going to be protecting the very family member of yours that you are here to visit, because this is where you intend to go home to your loved ones. These are the people that we are protecting by implementing a quarantine measure. And so it is very, very important for us to understand the reasons for it and the principles behind quarantine. For persons who are home quarantine, we inform them of the protocols of home quarantine. One is that they need to remain within a confined area. We receive reports all the time that there are people who are supposedly under home quarantine, but they are out climbing with their friends, they are at the bar socializing, and they find themselves in different places. That should not obtain. We cannot be at every single home 24 hours. Persons must take responsibility for themselves and the health of family members and the community at large. And we're dealing with a serious situation. We cannot trivialize what is happening today. And that is why it is so important for persons who are placed under home quarantine to pay particular attention to the protocols and observe them, because it is for your own good and for the good of the community, your home, and the country. Therefore, the protocols are explained to persons who are home quarantined.
And those protocols would be what?
One is to to remain within a confined area. So you need to have a separate bedroom and access to a separate bathroom from every other person in the household. Secondly is, you're not supposed to be mingling with everybody else in the house and using common areas. So you're supposed to remain to that confined space. And we say to persons that when they get served with disposable utensils. We also are advising persons who are home quarantined to, as much as possible, reduce the use of air conditioning, but rather for natural ventilation, because it would allow for air circulation and the use of air, the vitiated air, to be circulated in and out. So that is very, very important. We also advise the persons to pay attention to hand washing, to cough etiquette, like we have always done, because these are important. And these are some of the basic protocols that are in place in terms of home quarantine. But people choose to disregard and neglect these basic things. And as a result, it is putting persons at a higher risk. St. Lucia, to date, is not able to find the resources to quarantine every single person coming back in a public health facility. I mean, that would be the ideal way to go, but it is not practical at this point in time. Just today alone, we have over 160 persons from the international arena coming into St. Lucia. That's not from within the region, just internationally.
And these are returning nationals?
These are returning nationals, 99% returning nationals. We've seen an upsurge in the numbers that are coming up, because I don't know the reasons for it, whether the transmission from wherever they are probably have increased, or they're looking at there is still a window to travel to St. Lucia because our borders are not completely shut. But we've seen an increase in the numbers that are coming in. And as we get increase in numbers of arrival, albeit that they are St. Lucians, but the mere fact that they have been to hot spots, they are potential risk. And that is why they too need to be quarantined. So our public health persons, our nurses are doing a fantastic job at this point in time. It's ongoing situation. We don't always have the resources at hand. We want to thank the private transportation sector for willing to partner with us and to be able to transport people to a designated quarantine facility. And we want to thank the law enforcement persons who are working very closely with us to ensure that it happens. But we also want to appeal to the people who are in quarantine to do as much as possible to comply with the quarantine requirements, because it is at the end of it all, it is for your good and for the better good of the country as a whole.
What role does your department play, Mr. Ragnanan? Because as we indicated earlier, reports of persons coming through, not the official ports, but coming through other ports on across the island. So how are you collaborating with the police force on this in order to monitor what's happening there?
Sure. Not only do we collaborate with the police, but we also collaborate with Customs and Excise Department. They are a very key partner for us. St. Lucia, as we've known, has some porous spots. We see people now, because of the restrictions, especially in the French territory, who has closed their borders, are now taking unofficial route to try to get St. Lucia, means. So people are using pirogues and canoes and that kind of thing. It is very difficult to be able to monitor every single vessel that moves. But when people do come in illegally, we want to appeal to the families of these people to notify us. Because again, it is for the better good of every single person. That is why St. Lucia to date have not closed its borders. We still accept nationals coming into St. Lucia. But it's becoming more and more challenging as the day go by. However, the message that we want to send out there is for people who may be harboring such individuals to desist from doing that, to notify the health authorities, notify the police, because quarantine is not illegal in St. Lucia. It is legal. If you go to the Quarantine Act, it tells you about the procedures for quarantine. It gives the police powers of arrest and otherwise. And these are the laws of St. Lucia we're talking about. So it is not an illegal activity when we ask person to quarantine. It is mandated by and prescribed by law. And therefore the police has specific powers under the Quarantine Act. And therefore we would like persons to self-comply. Self-compliance is what we want. We do not want to go the extra mile because there are also fees and penalties under that same law that are well stipulated for people who are breaching the principles of quarantine.
CMO, you spoke about the Dominicans who came in and they ought not to have been with the group from Martinique. What have we done with them subsequently? Since they were on the same bus transported up to Rodney Bay, did we keep them at the quarantine facility?
No, we did not keep them. Those who came on the bus, we did give instructions as to how they were to be transported. And if you look, I saw the video that was circulating, you'd notice that there was a seat in the middle that was free. They were provided with masks and they were not seated next to each other on the bus. So on arrival, they were allowed to leave. And this caused a level of misunderstanding at the facility as well, because some of the persons who were at the quarantine facility, they were questioning why this small group was allowed to leave. So they thought it was unfair. So by the time we explained to them that these were passengers from Dominica and not from Martinique, it made it a lot clearer as to why we allowed them to leave. But it was an error. It was not supposed to happen, and it was not our instructions to happen. So we take the responsibility for that error. And it did put some level of risk on them. We admit it was an error.
Okay. With regard to the OKEU, we'll talk about respirators in a while, but OKEU, as you said this week, where are we at with that process? Are we at a 90% complete in getting that full transition?
Yes, well, the actual move of patients occurs from the 25th to the 27th, so that's between Wednesday and Friday. They have put out the notices explaining that they've stopped elective surgery for this week. They're doing patient reviews currently to ensure that only those that need to be in hospital are in hospital, to reduce the number of persons doing the actual move and to mobilize as much staff as possible during the move of those 3 days. As was explained in earlier reports, the team from Martinique was they were quite instrumental to supporting the move, but with the situation in Martinique, they are not available to provide that support. So the move is going to happen at the end of the week, and the hospital will be set up so that we can facilitate possible admissions for COVID-19.
Okay, now getting to Victoria Hospital as that respiratory clinic. Respirators, we know that it has been said that we are not anywhere near to having what we should. Can you give us an idea of what the picture is?
When you look at the number, based on information from what happens in other countries, because we were looking a lot at what is happening with the disease in other countries to guide us as to how and how we should be prepared. About 5% of the population, 4 to 5%, develop critical disease and may or may not require use of ventilators. And when we do an assessment of our in-country ICU capacity, it's 3 at VH, 2 at St. Jude's, but OKEU has a capacity for 6 ventilators. So we realize we are below what is needed if we are, because even to maintain our normal capacity, I think I'm not coming here to pretend that we have the health system that can support everything. I think everybody knows of the limitations that currently exist. And when you add COVID-19 to the mix, it further complicates it. So for us, when we do the assessment of our ICU capacity, we realize that to be able to manage with our normal needs and COVID-19, we are in deficit. So 14 ventilators have been ordered We had made an appeal to friendly governments to provide support, because ICU capacity requires specialized care, specialized nurses and specialists, which the training period is quite extensive. We did reach out to Taiwan, who was ready and able, but because of certain restrictions for travel, they were not able to assist, similar to India. But we are working closely with the government of Cuba, and they have estimated a total of 126 healthcare professionals. The plan is for them to come in on Friday of this week. I'm giving an estimate because things can go wrong, but they are planned to come in, they are scheduled, I should say, to come in on Friday to provide support to our healthcare system in the preparation and management of COVID-19.
We're looking at a large number, aren't we?
Yes, 126.
Okay.
It's quite big, made up of nurses and doctors.
Okay, so that's a definite boost for us.
Yes, it will assist us so that we can maintain our regular clinics, because we have to be very careful that in our focus towards COVID-19, our other patients who also have healthcare needs and need medication, need treatment, need review, that they are also taken care of. So it will allow us to extend, for example, the hours of our respiratory clinics. We've given the extra staffing, and we anticipate, if we are to have in-country transmission, that we may have numbers, so to reduce the wait time, having extra staff to be able to treat the clients. We are looking at that as well in anticipation. We presently do not have these high numbers coming in, but we are just planning in anticipation of increased numbers.
The announcement was made for retirees of the medical profession to call in and to avail themselves of it's a sort of part-time employment opportunity. Are we getting the sort of response expected?
We are getting some, but we note that retirees fall into the high-risk group. So what we would do, we would not put them into the front line for COVID-19, but we would use their support for our regular clinics, just so that we don't put them at risk. And I thank the collaboration with our private medical facilities, the Medical and Dental Association. We've gotten support from them. We presently have a total of about 22 private physicians who have volunteered to assist with the move of the hospital to provide support. Some of the doctors have said during that period they are willing to close their clinics and support the ministry. We've also gotten support for the doctors. As of tomorrow, we will have some private physicians assisting at the respiratory clinic. So we've gotten volunteers from the private medical fraternity to assist at the respiratory clinics, and we've also gotten assistance from the private sector to man the private medical phones where the public can call to get advice on their health. As I've indicated earlier, this is a national issue, so we've been getting support and from all sectors. This is a national issue. The Ministry of Health is not expected to do it alone, and from the activation of the National Health Security, this has really assisted and ensured that everything is done in a timely manner.
Okay, just on the final points now. With regard to the region, I know you say that we have a lot of returning nationals accessing through the U.S. port, but the region, I noticed that we have very little, like 1 case, 2 cases here and there in some of the countries. Are we still requiring nationals returning from the Caribbean islands, where you may have very little cases, to quarantine as well?
Well, it depends on where they're coming from. I don't think we have travel restrictions on any of the regional countries. The closest that we've restricted is Martinique from our restriction on France, but for the rest of the islands, we presently don't have travel restrictions. We look at the number of cases, we look at how they're managing the cases, we review the CDC travel advisories as well, and that is what we use to determine. And for example, for the US, from the 18th to the weekend, the numbers went up very quickly, putting them in a similar bracket to a lot of the countries that we have restricted. So it's a very dynamic situation, and this is one of the reasons that we try to give regular updates, because today I may say one thing and then by the next day we've had to make a change in policy to facilitate the dynamic situation that COVID-19 is causing.
Okay. And have you received, or is there any indication that those who are in quarantine, for those who may have absconded and returned, that any one of these individuals are showing signs and symptoms of flu or what is associated with COVID-19?
Well, within the Rodney Bay Public Health Facility, we have 3 persons in isolation, that is persons who have signs and symptoms. We are getting information because our teams will be working very closely in some of the communities that may be more of risk of persons who may have returned illegally. So we have to do a lot of work on the ground, monitoring those communities so that if there are any outbreaks of respiratory disease, we're able to pick it up in a timely manner, because we're moving from the initial containment to mitigation when we have those things happening where persons may have come in at risk and be within the community. So in an effort to contain, reduce impact, reduce spread, it means that we now have a lot of work to do within those communities that may be at risk. But the public, we continue to appeal. If you are aware, please, your nearest police station or the officials from health, share that information. This is your community. We want the safe transfer, and I say the safe transfer of those persons into care if needed.
And wonderful. Thank you so much there. We've been speaking with Dr. Sharon Belmar-George, who is the Chief Medical Officer, and Parker Ragnanan, who is the Chief Environmental Officer, as well as Dr. Wayne Felicien, who is the Director of the Ezra Long Laboratory Services. Of course, we will be keeping you updated as the situation changes. You know that it's very fluid, or just to reinforce some of the information that has already come through for you. Thank you so much to our partner stations for joining us for this important briefing. We're looking at Daha Broadcasting Services, DBS, Health Intelligence Systems, HDS, Radio Caribbean, the Wave and WVent Radio, as well as Choice TV, Great Vision Design Television, Calabash TV, NBC, Hot 7 and Hot FM, Blazing FM and Kiss FM, Vibe Radio, and Underground Television. Thank you so much. Again, we are partners in all of this in being able to reach the public. From the studios of the Government Information Service National Television Network, I am Lisa Joseph. Thank you so much for watching.